Hello, I'm David Catania. During my time in public service, I've been guided by the values that we as a community all share: an enduring belief in equality of opportunity, a strong commitment to fairness, and the importance of playing by the rules. I'm running for mayor of our great city because today more than ever, we need a government that reflects our shared values.
I don't feel other parents should have to go through this.
Shots rang out in a drive-by shooting along South Capitol Street, killing 4 young people.
Nardine is a real inspiration. While she was grieving, she still cared so much about the other young people.
I didn't want her death to be in vain. I wanted something to live on and other people benefit and are saved.
After nearly 2 years, Catania and Nardine Jeffries succeeded in getting final approval on a bill that will greatly expand mental health and truancy laws.
He committed himself to me, saying that he would not, just walk away and, we'd get through this. And we worked together really closely to work on the South Capitol Street Memorial Tragedy Act.
It's multifaceted. Among other things, it places a greater emphasis on early intervention and early diagnosis of mental health issues. It is a weaving together of many aspects of the bureaucracy so it can respond to young people.
Not only was he a man of his word, which meant a lot, and I felt I could trust him, but it also said to me that his character as a person, he cares.
I was raised by my mother, a single parent. One of the things that was very evident to me growing up, with a mother that didn't finish high school, was the importance of education, and she reinforced that.
David is a great listener. He came to one of the PTOs at Stanton Elementary. He just wanted to have a conversation with all the parents and the concerns that we had for Stanton. He was going to help in any kind of way.
There's no question that we have great challenges in our public schools, and these solutions cannot be crafted from the Wilson Building. Unless we actually went into the schools and met with our leaders, our teachers, and our parents, we could not begin to understand the complexities of the issues.
We couldn't get anyone to listen to us, to pay attention to us, to focus on our concerns until we went to David, because it turned out to be a problem that was affecting middle schools all over the city.
The issues that I'm tackling are the ones I'm hearing through my nearly daily visits to schools, where principals and leaders and parents are saying these are the challenges that we need to tackle if we are collectively as a community going to advance our public school system.
Without a doubt, this hospital would have been closed were it not for David Catania.
There are 150,000 people who live in this area who would not have access to an acute care hospital had they closed the hospital.
A number of the physicians wrote me and began to outline the challenges that the hospital is facing.
The Medical Executive Committee feels obligated to write this letter expressing our serious concerns about the ability of Greater Southeast Community Hospital to provide basic patient care.
The nurses hadn't been paid, and so the nurses simply walked out of the emergency room, leaving our citizens really in harm's way.
He actually came to the hospital and he sat us down and he said, "Explain to me what is going on here." I remember his exact words, and it's been over 7 years. "I will not let this continue," he said. "Every patient over here, I don't care what color they are, I don't care what religion they are, I don't care who they vote for, everyone deserves the right to have adequate medical care."
I'm really proud of the city's investment because it has brought much needed equipment and services to the residents east of the Anacostia River. Low-dose mammography equipment, improved dialysis equipment, and the first MRI east of the Anacostia River. Most importantly for me, we added a children's pediatric emergency room.
He was relentless, he was untiring, he would not let anyone stand between us and care of the patients.
And that's one thing David kept pounding in. It's going to be okay. I am not going to abandon you.
David is a man of his word.
When he sees problems, he identifies them, he talks about them, he learns about them, and he fixes them.
David's honest. He sticks to his word. He's hardworking.
He's concerned about the education over here. He's concerned about the hospital. He's concerned about the community and the neighborhoods and the families that are in them.
Our city faces big challenges, from improving our public schools to ending the income inequality which divides our communities and our neighbors. We've overcome big obstacles in the past, and with your support together, I'm confident that we can meet these challenges and we will restore faith in our government.